Medicine is something that has been around for hundreds and thousands of years. It has changed, it has adapted, and it has become an ever evolving study. There are always different types of medications and different practices of medicine. There's a big difference between Eastern and Western medicine. Eastern medicine is more of a traditional practice, whereas Western medicine is more technology based with pharmaceuticals. In Eastern medicine, you're going to find some things and practices that aren't very common. One of those practices is what I'm here to talk to you about today, and that's acupuncture. I believe that acupuncture is not a valid medical practice in this day and age. The history of acupuncture began in the Ming Dynasty. Info on this can be found in an article on amcollege.edu, which states the basis of modern acupuncture was established during the Ming Dynasty and expanded to the United States after President Nixon's visit in China in 1972. On the mayoclinic.org, there is a list of common reasons why people seek out acupuncture. The list includes headaches, labor pains, lower back pains. One of the more common things not listed is depression. Many people go seek treatments for depression in many different ways. An article found on scientificamerican.com says that patients on antidepressants who received acupuncture did significantly better than those who just took medication. Because acupuncture is such a rare and uncommon practice, it's harder to tell whether or not the patient's depression was cured due to the actual treatment itself or a placebo effect. There is an article on sciencebasedmedicine.org that's titled An Industry of Worthless Acupuncture Studies states despite thousands of studies, there isn't a single indication for which real acupuncture has been shown to work to a high degree of confidence. With such an unusual treatment, there are significant risks that come along with it. An article found on medicalnewstoday.com states the possible risks are the following: severe bleeding, if possibly on blood thinners, also infections from unsterilized needles, and also the needle may break and damage an internal organ, which can lead to a risk of a collapsed lung, which is also called a pneumothorax. A collapsed lung is a significant medical condition which requires a tube to be placed inside the patient's chest on the damaged side to reinflate the lung. This treatment leaves you up in the hospital for approximately 3 days or even possibly longer. With all these potential risks, it's hard to see the benefits that could possibly come from getting a whole bunch of needles placed into your body. I, for one, don't foresee this as a true medical treatment, and I think that it should be held off, at least for now, until further tests and studies could actually be performed. One thing we can do to help prevent these, although rare but severe occurrences, is to stop receiving acupuncture. Although they are rare, they can sometimes be life-threatening. With the research that I've been doing, I don't foresee a possible benefit that acupuncture has, other than it definitely being a placebo effect. I may sound very westernized and some might even say close-minded, but I really do not see the joy or perks of having myself turn into a character from a horror film. Thank you so much for listening to my persuasion, and I hope I have persuaded you to not receive acupuncture. Thank you and have a great night.